Hey, Alpha Nurses, I'm Licensure from alphanursesguy.com. These are NCLEX practice questions. Without delay, let's get started.
The client asked the nurse to explain what it means that his Hodgkin's disease is diagnosed at stage 1A. Which of the following describes the involvement of the disease? 1. Involvement of a single lymph node. 2. Involvement of two or more lymph nodes on the same side of the diaphragm. 3. Involvement of lymph node regions on both sides of the diaphragm. 4. Diffuse disease of one or more extralymphatic organs. The correct answer is 1. In the staging process, the designations A and B signify that symptoms were or were not present when Hodgkin's disease was found, respectively. The Roman numerals 1 through 4 indicate the extent and location of involvement of the disease. Stage 1 indicates involvement of a single lymph node. Stage 2, two or more lymph nodes on the same side of the diaphragm. Stage 3, lymph node regions on both sides of the diaphragm. And stage 4, diffuse disease of one or more extralymphatic organs. The client with Hodgkin's disease develops B symptoms. These manifestations indicate which of the following? 1. The client has a low-grade fever, temperature lower than 100 degrees Fahrenheit. 2. The client has a weight loss of 5% or less of body weight. 3. The client has night sweats. 4. The client probably has not progressed to an advanced stage. The correct answer is 3. A temperature higher than 100.4 degrees Fahrenheit, profuse night sweats, and an unintentional weight loss of 10% of body weight represent the cluster of clinical manifestations known as the B symptoms. 40% of clients with Hodgkin's disease have B symptoms, and B symptoms are more common in advanced stages of the disease. The client with Hodgkin's disease undergoes an excisional cervical lymph node biopsy under local anesthesia. After the procedure, which does the nurse assess first? 1. Vital signs. 2. The incision. 3. The airway. 4. Neurologic signs. The correct answer is 1. The nurse must ensure that sterile technique is used when a biopsy is obtained because the client is at high risk for infection. In most cases, a lymph node biopsy is sent immediately to the laboratory once it is placed in a specific solution in a closed container. It is not necessary to wear a gown and mask when obtaining the specimen. It is not necessary to use special handling procedures for the instruments used. Which of the following clinical manifestations does the nurse most likely observe in a client with Hodgkin's disease? 1. Difficulty swallowing. 2. Painless, enlarged cervical lymph nodes. 3. Difficulty breathing. 4. A feeling of fullness over the liver. The correct answer is 2. Painless and enlarged cervical lymph nodes, tachycardia, weight loss, weakness and fatigue, and night sweats are signs of Hodgkin's disease. Difficulty swallowing and breathing may occur, but only with mediastinal node involvement. Hepatomegaly is a late-stage manifestation. In providing care to the client with leukemia who has developed thrombocytopenia, the nurse assesses the most common sites for bleeding. Which of the following is not a common site? 1. Biliary system. 2. Gastrointestinal tract. 3. Brain and meninges. 4. Pulmonary system. The correct answer is 1. The biliary system is not especially prone to hemorrhage. Thrombocytopenia, a low platelet count, leaves the client at risk for a potentially life-threatening spontaneous hemorrhage in the gastrointestinal, respiratory, and intracranial cavities. The client with acute leukemia and the healthcare team establish mutual client outcomes of improved tidal volume and activity tolerance. Which measure will be least likely to promote outcome achievement? 1. Ambulating in the hallway. 2. Sitting up in a chair. 3. Lying in bed and taking deep breaths. 4. Using a stationary bicycle in the room. The correct answer is 3. The client with acute leukemia experiences fatigue and deconditioning. Lying in bed and taking deep breaths will not help achieve the goals. The client must get out of bed to increase activity tolerance and improve tidal volume. Ambulating in the hall is a sensible activity and helps improve conditioning. Sitting up in a chair facilitates lung expansion. Using a stationary bicycle in the room allows the client to increase activity as tolerated. In assessing a client in the early stage of chronic lymphocytic leukemia, the nurse should determine if the client has 1. Enlarged painless lymph nodes, 2. Headache, 3. Hyperplasia of the gums, 4. Unintentional weight loss. The correct answer is 4. Clients with CLL develop unintentional weight loss, fever and drenching night sweats, enlarged painful lymph nodes, spleen, and liver, decreased reaction to skin sensitivity test antigen, and susceptibility to viral infections. Enlarged painless lymph nodes are a clinical manifestation of Hodgkin's lymphoma. A headache would not be one of the early signs and symptoms expected in CLL because CLL does not cross the blood-brain barrier and would not irritate the meninges. Hyperplasia of the gums is a clinical manifestation of AML. Which of the following individuals is most at risk for acquiring acute lymphocytic leukemia? The client who is 1. 4 to 12 years, 2. 20 to 30 years, 3. 40 to 50 years, 4. 60 to 70 years. The correct answer is 1. The peak incidence of all is at 4 years of age. All is uncommon after 15 years of age. The median age at incidence of CML is 40 to 50 years. The peak incidence of AML occurs at 60 years of age. 2/3 of cases of chronic lymphocytic leukemia occur in clients older than 60 years of age. The goal of nursing care for a client with acute myeloid leukemia is to prevent 1. Cardiac arrhythmias, 2. Liver failure, 3. Renal failure, 4. Hemorrhage. The correct answer is 4. Bleeding and infection are the major complications and causes of death for clients with AML. Bleeding is related to the degree of thrombocytopenia, and infection is related to the degree of neutropenia. Cardiac arrhythmias rarely occur as a result of AML. Liver or renal failure may occur, but neither is a major cause of death in AML. The nurse identifies deficient knowledge when the client undergoing induction therapy for leukemia makes which of the following statements? 1. I will pace my activities with rest periods. 2. I can't wait to get home to my cat. 3. I will use warm saline gargle instead of brushing my teeth. 4. I must report a temperature of 100 degrees Fahrenheit. The correct answer is 2. The nurse identifies that the client does not understand that contact with animals must be avoided because they carry infection, and the induction therapy will destroy the client's white blood cells. The induction therapy will cause anemia, and the client will experience fatigue and will have to pace activities with rest periods. Platelet production will be decreased, and the client will be at risk for bleeding tendencies. Oral hygiene will have to be provided by using a warm saline gargle instead of brushing the teeth and gums. The client will be at risk for infection owing to the decrease in WBC production and should report a temperature of 100 degrees Fahrenheit or higher. A client states, I don't want any more tests. Who cares what kind of leukemia I have? I just want to be treated now. Which is the nurse's best response? 1. I'm sure you are frustrated and want to be well now. 2. Your treatment can be more effective if it is based on more specific information about your disease. 3. Now you know the tests are necessary and that you are just upset right now. 4. I understand how you feel. The correct answer is 2. The nurse is an advocate for client with leukemia who can be empowered with knowledge of the treatment. Immunologic, cytogenic, morphologic, histochemical, and other means are used to identify cell subtypes and stages of leukemia cell development for very specific and optimal treatment. The nurse should not label the client's feeling, such as frustration or emotional. Only the client can identify her own feelings. Chastising the client is not helpful. It disavows the client's emotional state and responses to her diagnosis and involved treatment. Unless nurses have had leukemia, they cannot possibly know how the client feels, even though they may be trying to offer her empathy. A client is about to undergo bone marrow aspiration of the sternum. Which of the following statements should the nurse include to provide information to the client about what the client will feel during the procedure? 1. You may feel a warm solution being wiped over your entire front from your neck down to your navel and out to your shoulders. 2. You will not feel the local anesthetic being applied because it will be sprayed on. 3. You will feel a pulling type of discomfort for a few seconds. 4. After the needle is removed, you will feel a bandage being applied around your chest. The correct answer is 3. As the bone marrow is being aspirated, the client will feel a suction or pulling type of sensation or discomfort that lasts a few seconds. A systemic premedication may be given to decrease this discomfort. A small area over the sternum is cleaned with an antiseptic. It is unnecessary to paint the entire anterior chest. The local anesthetic is injected through the subcutaneous tissue to numb the tissue for the larger bore needle that is used for aspiration and biopsy. After the needle is removed, pressure is held over the aspiration site for 5 to 10 minutes to achieve hemostasis. A small dressing is applied. A large pressure dressing, such as an ACE bandage, would restrict the expansion of the lungs and is not used. The nurse should remind the unlicensed personnel that which of the following is the most important goal in the care of the neutropenic client in isolation? 1. Listening to the client's feelings of concern. 2. Completing the client's care in a non-hurried manner. 3. Completing all the client's care at one time. 4. Instructing the client to dispose of the tissue used after blowing the nose. The correct answer is 4. The most common source of infection and microbial colonization in neutropenic clients is their own non-pathogenic normal flora. Attention to personal hygiene, such as oral, pulmonary, urinary, and rectal care, is essential. It is important to acknowledge the client's concerns and fears and to provide organized, non-hurried caring care. But it is more important to teach the client how to prevent an infection that could be life-threatening. The nurse should teach the client with neutropenia and the family to avoid which of the following? 1. Using suppositories or enemas. 2. Using a high-efficiency particulate air filter mask. 3. Performing perineal care after every bowel movement. 4. Performing oral care after every meal. The correct answer is 1. The neutropenic client is at risk for infection, especially bacterial infection of the respiratory and gastrointestinal tracts. Breaks in the mucous membranes, such as those that could be caused by the insertion of suppository or enema tube, would be a break in the first line of the body's defense and a direct port of entry for infection. The client with neutropenia is encouraged to wear a HEPA filter mask and to use an incentive spirometer for pulmonary hygiene. The client needs to know the importance of completing meticulous total body hygiene daily, including perineal care after every bowel movement, to decrease the flora at normal body orifices. The client also needs to know the importance of performing oral care after every meal and every 4 hours while the client is awake to decrease the bacterial buildup in the oropharynx. Which factor, in addition to the degree of neutropenia, should the nurse assess in determining the client's risk of infection? 1. Length of time neutropenia has existed. 2. Health status before neutropenia. 3. Body build and weight. 4. Resistance to infection in childhood. The correct answer is 1. The one factor that may be more important than the degree of neutropenia in determining the risk for infection is the duration of the neutropenia. The nurse is developing a care plan for a client with leukemia. The plan should include which of the following? Select all that apply. 1. Monitor temperature and report elevation. 2. Recognize signs and symptoms of infection. 3. Avoid crowds. 4. Maintain integrity of skin and mucous membranes. 5. Take a baby aspirin each day. The correct answers are 1, 2, 3, and 4. Nursing care of a client with leukemia includes managing and preventing infection, maintaining integrity of skin and mucous membranes, instituting measures to prevent bleeding and monitoring for bleeding. Aspirin is an anticoagulant. Bleeding tendencies, such as petechiae, ecchymosis, epistaxis, gingival bleeding, and retinal hemorrhages, are likely due to thrombocytopenia. The daily white blood cell count in a client with aplastic anemia drops overnight from 3,900 to 2,900 microliter. Which is the appropriate nursing intervention? 1. Continue monitoring the client. 2. Call the laboratory to verify the report. 3. Document the finding. 4. Call the physician and request that the client be placed in reverse isolation. The correct answer is 4. The client will need a prescription from the physician to be placed in reverse isolation because the normal defenses are ineffective and place the client at risk for infection. The faster the decrease in WBCs, the greater the bone marrow suppression, and the more susceptible the client is to infection from not only pathogenic but non-pathogenic organisms. The client will continue to be monitored. The laboratory may be called, and the report will be placed on the chart, but protection of the client must be instituted immediately. Which of the following is an assessment finding associated with internal bleeding with disseminated intravascular coagulation? 1. Bradycardia. 2. Hypertension. 3. Increasing abdominal girth. 4. Petechiae. The correct answer is 3. As blood collects in the peritoneal cavity, it causes dilation and distension, which is reflected in increased abdominal girth. The client will be tachycardic and hypotensive. Petechiae reflect bleeding in the skin. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation? 1. Treating the underlying cause. 2. Administering heparin. 3. Administering warfarin sodium. 4. Replacing depleted blood products. The correct answer is 3. Disseminated intravascular coagulation has not been found to respond to oral anticoagulants, such as warfarin sodium. Treatments for disseminated intravascular coagulation are controversial, but include treating the underlying cause, administering heparin, and replacing depleted blood products. A client who had a splenectomy is being discharged. Of the following discharge instructions, which is most specific to the client's surgical procedure? 1. Do not drive. 2. Alternate rest and activity. 3. Make an appointment for the staples to be removed. 4. Report early signs of infection. The correct answer is 4. Clients who have had a splenectomy are especially prone to infection. The reduction of immunoglobulin M leaves the client especially at risk for immunologic deficiency infections. All clients who have had major abdominal surgery usually receive discharge instructions not to drive because the stomach muscles are not strong enough to brake hard or quickly after the abdominal muscles have been separated. All clients need to pace activity and rest when going home after major surgery. Rest and sleep allow the growth hormone to repair the tissue, and activity allows the energy and strength to build endurance and muscle strength. An appointment is usually made to see the surgeon in the office 1 week after discharge or follow-up, and to remove sutures or staples if this has not already been done.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.